Welcome, everyone, and thanks for listening in to our first ever episode of the Chat with the Chair podcast. Today we're joined by Dr. Rodney Taylor, Professor and Chair of Otorhinolaryngology, Head and Neck Surgery at the University of Maryland School of Medicine. Thanks for being with us today, Dr. Taylor.
It's a pleasure to be here.
Why don't you start off by telling us a little bit about yourself?
Sure. Again, I'm Rodney Taylor, and I've had the fortune of being here at the University of Maryland for what will be next month, 21 years.
Wow.
And prior to coming and joining the faculty at University of Maryland, I completed my head and neck surgery training at the University of Michigan, and I did college and medical school at Harvard University. I'm a Philadelphian by origin, and I have an array of interests both in and outside of medicine. I like to think of myself a little bit sporting, and so I like to run marathons and, chase a golf ball across the course from time to time, and just really love spending time also with the community and being a part and engaged in the community that we work and live in.
Why did you become a head and neck surgeon?
There are probably multiple reasons, but certainly early influences included time in medical school, where I can point to there was an upperclassman who was about to graduate from medical school, and he was going into something I hadn't heard before, this specialty called Otorhinolaryngology. And as he explained some of it, it just piqued my interest. And it put it on the radar that as I got a chance to get into my clinical rotations, to make sure that I didn't miss it. And when I began to rotate clinically, I met someone who has become a friend, a mentor, who continues to be both, who was just so charismatic, a lifelong learner, curious, and just very enthusiastic. And he happened to be an otorhinolaryngologist, and we really bonded. And it was under his tutelage that I saw the breadth of otolaryngology. Certainly in otolaryngology, you take care of patients from the cradle to the grave, each gender. And so the cross-section of your patient population really looks like the world. And it's not only women, or it's not only kids. It really can be all of that. And so when I saw the array of conditions, diseases, the affiliated research questions that were being asked in that field, and many other people beyond my mentor, his name is Marshall Strome, I was strongly drawn into the specialty. And as I got drawn in, it just became more and more and more. I discovered just so many other wonderful things about our specialty from a clinical practice, a research standpoint, its balance of being both the expert in medical conditions of the head and neck, but also the primary surgeons of that specialty. So whereas with the heart, you might have a cardiologist and you may have a cardiac surgeon, in our field, we are both the medical and surgical experts. And it's something about that completeness around care that also was appealing to me.
What are you most proud of, the work that you've done or your team has done here at University of Maryland?
I'm lucky to say that it's difficult to single out any one thing. But as I give that some thought, while I'm proud of some of the awards and recognitions that we've received, being a top program in the country, we've been ranked as high as number 10 by the U.S. World and News Report and other organizations. What I'm most proud is that we've built an atmosphere, a community of experts where collaboration, collegiality, values of family are foremost. And so then when you step into the doorway to come to work, people are excited and elated to be here and to see their colleagues and to work with their colleagues and to build excellence with their colleagues. And so ours is a mission that isn't singular, but it is collective with the shared values that a family would have. And that's what I'm most proud about. And I think that it allows us to accomplish things in unison and have a shared vision that elevate the entire group, rather than individuals sort of really being more concerned about their career and this and that. And I think it's that environment that we've been able to create and foster and hand down to our residents, and that our patients are able to benefit from. Those are the things, I think those are the things that I'm most proud of. There are many things, but that atmosphere, that community, where our patients are the direct beneficiary of us coming together that way is what I'm most proud of.
When you discussed why you became a head and neck surgeon, you touched on the fact that there were these research questions involved that really piqued your interest. What research is currently being done here within the Department of Otorhinolaryngology, and does it make our program unique compared to others?
Again, I'm proud that we rank among the very top programs in the country from research in terms of NIH funding, which is sort of the benchmark of excellence in research. And we're one of the top programs in the country, even when you compare it to programs much bigger than ours. And that research includes the genetics of hearing loss. It includes understanding what are some of the other genetic mechanisms that lead to failure of hearing and or deafness. It includes our research cancer and how we discover cancer. And so what we call the epigenetics of cancer, we have rigorous pursuit around that, where we're literally trying to understand the mechanisms of how cancer happens so that we can cure it. We have robust interest and collaboration in cancer stem cells and how cells uniquely become derive into cancer stem cells and become very resistant to treatment. And we are uncovering the mechanisms by how they do that, with, again, the near-term goal of developing drugs and strategies to really treat and cure cancer. We study pediatric otolaryngology conditions such as obstructive sleep apnea, the cognitive behavioral effects that has on the developing child, and how are ways that we can continue to intervene, prevent, and get kids past some of the sequelae that happen with that. And so we really cover the full array of research topics around otolaryngology. And I think that the balance that we try to achieve with our clinical excellence and our research excellence, and then with service, education and service. And so we're training residents who go on to become exceptional and leaders in our field. But we feel the importance of giving back. And so we routinely do humanitarian missions around the world, and we bring our residents as well, so that they can understand and get a different lens on our mission and the good fortune that we have in treating patients, not just in our local community, but around the world. But I think what we're unique and very deliberate about is having a world-class clinical program that a patient can walk in our doors and have a community hospital feeling, where we are clear about bringing humanity to the care of our patients, that we are not at all interested in just treating a disease. We're interested in learning about our patients and taking care of the whole patient, and not, some condition that they might have come to see us. And so I think that's what makes us unique, and our ability to provide excellence across all the core missions of an academic medical center, but doing so with a touch of humanity that really is patient-centered.
How do you see the field of ENT and head and neck surgery changing over the next 5 to 10 years, whether that be clinically, with patient care, research, your involvement with the community, and how important that may be when you consider all parts of taking care of a patient? How do you see this field changing?
I think there will be important strides and improvement and changes across all of the platforms you just described. And so when I say clinical and research, I think there will be some translational gains. And translation is really where research and clinical practice intersect. And I think that there will be opportunities for new molecule, new drug discovery and design that will actually change the practice of how we care for patients. I believe that there will be additional discoveries. There have been advances in sort of, altering and modifying genetic defects that we will see in real time in the care of our patients, whether it be hearing loss or cancer. I think from a clinical practice, we'll continue to have advances on minimally invasive approaches to care. And so even during my career lifespan, some of the, I think, larger open procedures that we did to cure cancer, we're doing much more minimally invasively with robotic care, where patients are having better quality of life, similar and improved outcomes, shorter hospitalizations, and avoiding things like radiation that may have a long-term fingerprint on the patient. We'll continue to make advances in that regard with our collaboration with other disciplines like neurosurgery, our skull-based practices, continue to work together to be able to get to places in the central nervous system with our shared otolaryngology and neurosurgery partnerships that will lead to better quality of life, better advances for our patients as well. And I think we'll continue to see progress along all of those fronts.
In addition to leading the Department of Otorhinolaryngology, you also provide clinical care yourself. What do you specialize in? And also, what is your approach to patient care?
My clinical practice has changed and evolved since I've been here over the past 20 years or so. And when I first came and we were a division in a smaller department, I did virtually everything in ENT, from pediatric to ear surgery, skull base, sinus disease, endocrine surgery, you name it. As we have continued to grow as a department and recruiting really some of the best subspecialists in our field, my practice has contoured itself and has always had a focus on head and neck oncology, and that's the care of the head and neck cancer patient. And that has continued to grow. And I continue to do care of patients with sinus disease and skull-based disease, but less pediatric in ear, for example, and voice disorders. As I have colleagues who do that more often and even better than me, I'm proud to say, my practice has really shaped and contoured itself to focus on the care of cancer patients, skull-based, rhinology, and sinus disease, and that certainly keeps me really busy and fulfilled. And I think continues that in spite of leading a department, it allows me to always have at my core that patient care relationship and dynamic, which drives everything that we do here, not only in otolaryngology, but at the University of Maryland.
What makes a great physician?
Oh, wow, there are many things. And I think when you say physician, in my lens as a surgeon, I will kind of combine those. And I think a lot of what makes a great surgeon has everything to do with what happens before you go to the operating room. It is how you prepare a patient and the shared decision making about what their care is. It is how you organize and align and ready everything before you have your final surgical plan. It's how you have your colleagues participate and bring in their vision, their expertise in the care of our patients, particularly our complex head and neck cancer patients. And it is how you do that, how you form the relationship with the patient, how you prepare the patient to have a in-depth understanding of what they're getting into and being able to participate in the decision of their care. That makes a great physician. And then certainly for a surgeon, you have to be technically sound and knowing when to operate, how to avoid complications, and there's certainly an important technical component. But a lot of the non-technical component is just as important as the actual surgical acumen. And I think individuals who can help patients understand and participate in their decision-making and bring in the non-technical and the technical component is really important. And I know for me too, when I'm seeing patients, the very first thing I want to know is what makes them happy, what makes them fulfilled, what do they enjoy, what's fun. And a lot of our early conversation is that long before we discuss the details or the condition that they're actually being referred to see me for. And it gives me an understanding of the patient's goals and what success looks like beyond the successful treatment of their disease. And I think it allows the patients to understand that I'm far more interested in them than whatever the condition that they had. I'm interested in the human components of what drives their happiness and their fulfillment and so forth. And it is the early part of how we establish our rapport, which often winds up being a very longitudinal and long relationship that has lasted decades.
Have you found that once you are able to build that relationship and really try to understand the patient, their personal preferences, their goals, etc., that helps them to become more compliant before and after their surgery?
100%. And because, part of what builds compliance is understanding and participation. And when they are participating in the decisions and their care, they have ownership. And I find that when they have ownership in that process, they're far more engaged, they're far more compliant, they show up in a timely way, there's not no-shows, and they ask smart questions that give me additional insight into what may be challenges that could otherwise impact compliance. So I do find that.
So you've been here for 20 years or just over 20 years. Are there unique ways in which our surgeons and physicians have to approach patients in a large city?
The answer is certainly yes. And something that is very clear, not just to me, but to our department, something we take great pride in, is that we are an anchor institution for Baltimore and for West Baltimore. It's just part of our identity. It's just part of our ethos. It's inseparable from the other important roles and the way we see ourselves. We are integral to this community, just as this community is integral to us. And so, our physicians don't simply stay in the office to see patients or their administrative offices on a routine basis. We get out into the city and we meet our referring doctors within the community where we derive our patient referrals. And we get out beyond the city and across the Eastern Shore into rural communities. And so I think it gives us a nice perspective in understanding the environment that our patients come from, whether it's a more rural or farm environment, or if it's the inner city. We are getting out of the comfort of our offices to kind of meet our patients and the referring physicians where they are, and not simply relying on them to come to us because we're here.
For those listening who are considering pursuing a career in head and neck surgery, what's your best advice for them?
To be curious and to ask questions. I feel like I never even knew what otolaryngology was until I went to medical school. And at my medical school, I could have easily graduated without having any direct interaction with the otolaryngology department, because many of the core clinical services that are required within the medical school curriculum, otolaryngology is not a part of those core curriculum. And so you have to seek it out. And so if you don't know about it, you could easily miss it. And so it's asking questions. And then if you are curious, we really like to make ourselves available to students at every level. We have high school students, college students, medical students, graduate students come and visit with us and will shadow me, students from our local community and from around the country. And so it is really kind of immersing yourself and learning a little bit about what are the requirements specifically to pursue a field in otolaryngology, which is a small and very competitive field. And it's important, I think, the earlier you know, to prepare yourself to be a competitive applicant. And so I would say stay curious, reach out, ask questions, and sooner rather than later.
Are there any opportunities upcoming for those listening in to network with you, either at a conference, an academy meeting, anything similar like that, where they can connect with you better?
I have some leadership roles in terms of I'm the chair of the Head and Neck Cancer Committee for our National Academy, and we allow volunteers to come, and if they want to pursue and participate in September, they can do that. I was informed that our Diversity Committee through our National Academy received the Best of the Best awards for national media in healthcare space for the work that we did in diversity training and unconscious bias for both patients and physicians within our specialty. So there are a couple platforms that folks can engage in to hear not only me, but some of my other colleagues from around the country to get more insight into otolaryngology.
I would assume you're also available for grand rounds presentations, meet and greets, whether that be virtual or in person, etc.
Absolutely. And especially with, I think, the accelerated advent of virtual engagement, I am asked to do speaking topics both nationally and internationally. I just got back from Minneapolis recently, which I really enjoyed, being the graduation speaker for the University of Minnesota's otolaryngology program, and I've got some grand rounds and lectures to give over the next couple months. There's actually one that the University of Maryland is putting on that's a national event. It's the ICEC, an organization that tries to help with access for the cancer patients. And so I'll be a panelist on that committee and have an opportunity to share some of my thoughts on how we as physicians can enhance access for our patients. And so there will be some things over the next few months that'll be really fun and allow our public to get more informed about some of the work we're doing.
Before we say goodbye, is there anything else you think our listeners should know, or misconceptions about your field that you'd like to clear up?
For anybody who thinks that ear, nose, and throat surgeons are nerds, we are the hip, fun surgeon physicians of the medical specialty. And we may be a small group, but to get to know us is to love us. And so for any of you who want to dispel that stereotype, come meet one of the ear, nose, and throat doctors and learn a little bit about some of the coolness that we're really proud of.
Thanks again for stopping by for Chat with a Chair, brought to you by University of Maryland Faculty Physicians, Inc. For more information about today's guest or to listen to additional episodes, visit umfpi.org/podcast. Until next time.